Welcome to the first in-person REMAC in 2 years. Just in case you thought this building might not still be here. Still here.
We tried to shut it, but
Everyone looks the same.
Yeah, nobody's changed. I'm sorry, Dr. Schenker and Dr. Rabrich are not here, so I will chair. Doug says the power is going to my head.
Third string, yep.
What's that?
Water boy, no, sorry.
So we'll start with the roll call.
Robert Winchell, Joseph Schenker,
Because we're all a lot taller than I remember.
Michael Batch, Robert Ackerman,
He's really tall.
Laura Ivacoli, Stuart Kessler, Matthew Fink, Wallace Carter, Eric Cohen, Kevin Munjal, Cindy Basilios, Grace Cacciola,
Here.
Dario Gonzalez, Glenna Seda, Bradley Kaufman,
Here.
Nathan Reisman,
Here.
Pamela Lai,
Here.
Nicholas Alexandru,
Here.
Doug Isaacs,
Here.
Kevin Ward, Anne Marie Brigenti, Samia McEachin, Allison Burke, Jeffrey Rabrich, Reed Caldwell, Louis Marshall,
Here.
Michael Redlener, Dominic Battinelli, Efren Rendon, Peter Wire, Paul Barbara,
Present.
David Benelli,
Check out.
Mary Foote, Mark Cantor,
Here.
Sharice Berry, Ed Jarvis, Joseph Bove, Sean Graves, Jessica Bambarese,
Here.
Benjamin Zabar,
Here, sorry, I was muted.
I was
You're
waiting
allowed.
to use that then. Thanks.
Matthew Harris,
I'm
Again?
I know.
Adwa Smalls Manti, Robert Krupe,
Here.
Arthur Cooper,
Here.
Digil Langsam, Anthony Shalish.
Okay, while we check for a quorum, I just want to thank you guys for coming in person. I mean, this is, it feels like a very big lift after we haven't had to do this for a very long time.
We have a quorum.
And we have a quorum.
I'm passing out the sheets so we can sign it.
So we'll start with the correspondence report.
I could do that very quick.
Oh, I'm sorry. See? We'll start with the approval of the minutes from the May 3rd meeting. Any comments on the minutes, previous minutes, corrections? Seeing none, all in favor, say aye.
Aye.
Opposed? Abstentions? Now we'll go to the correspondence.
Okay, we received emails from Stu Kessler, Digil Langsam, Dr. Smalls Manti, and Robert Winchell saying they needed to be excused. The New York State Bureau of EMS is conducting a New York State REMSCO sustainability survey, and we have the app, the link to the app, so everyone can go and take it. There is a certified instructor update course being given online by the State Department of Health, and it's on the Vital Signs Academy site. Okay. The following enforcement actions were sent from the Department of Health. Salvatore Viola from Whitestone, New York, this is one of ours, EMT 438377, and he is suspended, suspension stayed. Mark Blackburn from Jerry, New York, EMT 467799, surrendered. Harris Crone, Lake Grove, New York, EMT 469744, suspended but stayed. Kathleen Amy from Liverpool, New York, EMT 452351, suspended for 1 year. Kevin Coronel, Gap Hank, New York, EMT 470842, certification voluntarily surrendered. And the City of Long Beach Fire Department also had to pay a civil penalty of $2,000 for violations of Part 80. These and all enforcement actions can be found on the DOH Disciplinary Actions and Enforcement Actions page, which we also have a link that'll be in your minutes. EPCR regional endorsement was received for citywide mobile response, and North Shore University Ambulance and Flatlands VAC renewed their ALS agency. We have a virtual CME being provided by New York Presbyterian Queens and Glen Oak VAC on geriatric trauma. Jamaica Hospital is also having call review, and all the specifics will be in your minutes, and they're already posted on our webpage. We also have Mount Sinai injury reduction programs. Westchester Medical Center is doing an annual trauma symposium, and that's July 15th. Pulse Check is October 6th to 9th, and as I said, everything is on our website. We sent out agendas, minutes, and associated attachments for this meeting, and the Bureau of EMS is having its next meeting July 18th and 19th,
Yeah.
and it's back to Troy, thank goodness. We sent out a REMAC advisory 2022-03 for EMT mandatory blood glucose levels. It was sent to all agencies and was posted. We also sent out an advisory about amiodarone dilution. It's not limited to D5W anymore. You can dilute with normal saline. And that's it. Oh, Article 30 committee. Anyone that is interested in giving me their language that they would like to have included in Article 30 revisions, please send it to me. I'm on the state committee, and I'll make sure that this language gets sent to them. And that's the end of correspondence.
Great, thank you. So there were no executive committee actions since our last meeting. So we'll move on to our subcommittee reports, starting with CNC, Dr. Barber.
No, Dr. Benelli should give the report of the medical standards. I make a motion that Dr. Benelli gives the report of medical standards.
Okay, let's start with medical.
Since he has to give it twice.
No, I gave the subcommittee gave the report to the committee.
That's
The
right.
committee reports to the REMAC.
Okay,
Yeah,
Dr.
yes,
Benelli.
yes.
we'll
Please
start with-
interpret what we discussed for me,
We'll-
Dr. Benelli.
Okay.
We'll
so-
start with medical standards.
Yeah, why don't we
Dr.
start with
Benelli.
medical standards? So medical standards, as some of you may know, has just met prior to this meeting, and we had a lively discussion that is clearly because we're all present here. And we had a couple of motions that were, a couple of topics that were discussed. The first one is CNC committee that did a fantastic work in revising the way we recertify our providers, with them moving away from a 3-year exam to a hopefully quarterly update. Am I correct?
That's true.
Using the LMS in order to do that. There is a manual that was provided, that was sent out to us this morning, that details this process. We voted in medical standards to allow for 2 weeks for everyone to review this manual and to bring up any comments or discussion. And then we're gonna have a vote via email, via Microsoft Forms, to approve or not to approve this proposed change, which is an enormous, tremendous, fantastic change that really moves our region forward with regard to how we credential our providers. So that's with the CNC committee. Any discussion about that?
So I'm sorry, so is that a seconded motion for the REMAC?
It
or-
is not at this point.
So it's just information?
Just informational, and then we'll have to be, I guess, forward to REMAC.
Or
Or can go to the executive committee. Right.
So there's a second, I think this is a seconded motion to review this, or?
Okay, so why, yes, sir.
I move that we move
To approve.
the findings of medical standards to the REMAC, that REMAC approve them, and then we can do the vote in
Perfect.
2 weeks, okay?
Okay, I second that.
Okay,
Yeah.
so we have a second motion, any discussion?
And that's it, right? We're not sure.
I'm not chairing you, that's right.
Any discussion on the motion? If not, we'll take a vote. So all in favor, raise your hands.
What is the motion?
So, sorry. So, it's a point of information. So the motion is to approve, to have a vote on the on the CNC's recommendation to have the change in the recertification process that was presented.
Pending the vote.
So pending the vote of both medical standards and REMAC
In 2 weeks,
in
that's
2
right.
weeks. Okay, so there will be a form, a Microsoft form sent out. Okay, it's pretty straightforward to fill it up. Dr. Zabor, you're making,
I'm just listening.
You're grimacing
I'm listening to
over
the motion. That's all.
okay. And once we all have a chance at medical standards and REMAC to review this report, this manual, we will vote on it and that will be the approval. Any discussion on this before we vote on it?
So there's a little, I guess, a point of information, it's a little confusing, because we're voting, the motion is to have a vote in 2 weeks. Have medical standards have a vote in 2 weeks, right?
And for us to vote in 2 weeks,
That was.
So
Dr.
then
Cooper's
subsequently,
motion.
that will come to this committee for a vote, or it doesn't need to?
both.
It's a point of
Right.
information. Okay. It
It will be
doesn't,
both REMAC and medical standards voting in 2 weeks to approve this. I don't know where in Roberts it says that.
Okay, I interpreted this as, tell me, Dr. Cooper, if I'm wrong. Motion is to approve the recommendation of medical standards to hold a vote within 2 weeks, and then REMAC will support the decision of that vote,
okay.
I'm good with that.
okay? This way we don't have to go back.
So if it passes medical standards,
Then it's
Yeah.
approved.
it
Then it's
passes
done.
REMAC.
No,
We need the
No.
we
idiot.
both have to vote,
Okay, so
REMAC
REMAC has to
has to
vote
vote.
too?
yeah.
Okay,
I'm good with either.
I think REMAC has to vote as well, that's why I wanted to clarify it.
okay.
All right, I'm sorry, so it sounds like there's no motion then that we're voting on now.
Correct, it doesn't sound like it was.
It doesn't sound like there's a motion. So this is just information.
No, there's,
No, this
it
is,
is a motion.
it is a motion. It's a motion to support the process that allows us to hold a vote in 2 weeks. That's
Yeah.
what it's about.
The clarification is that the vote in 2 weeks needs to be the REMAC members, not the medical standards.
Both, both.
Well,
Has to pass medical standards before it goes to REMAC.
Yes.
And because of the need to read the document, we have to delay both votes, so it'll actually be
You
2
don't-
votes,
Yeah, and they'll be done.
one
electronically.
contingent on the other.
Yes.
While we're discussing, you
Yes.
don't have to, you can do things only at REMAC. You don't have to do them at both medical standards and then REMAC.
Excellent.
We can always do things at REMAC. We don't, but not vice versa. You hear me?
That is true, that's very true. I mean,
That is true, but I made the motion the way I made it
Yeah.
because CNC is a subcommittee of
Right.
med standards. So
CNC
just
reports
trying-
the medical standards.
Just trying to, make sure all the refs in the room get a chance to touch the ball.
So any other discussion on the motion from Dr. Cooper? If not, all in favor, raise your hands.
Come on, Pam, you can do it.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, okay.
All opposed? Any abstentions? Thank you. So the motion passes.
very good.
Dr. Benelli?
I believe that was the, what we discussed in.
That's the only motion
That was the
of
only
u-
motion I
of
was called for
utility.
from CNC. Then we had a lively discussion with the protocol committee. There are a couple of protocol changes that are brought as second in motion from medical standards to REMAC for approval. I'm gonna ask Dr. Lai to review them, simply because she has the presentation mode over there, so, Dr. Lai.
Okay, so the protocols that came forward from the Medical Standards Committee are the dysrhythmia protocol as well as their sub-protocols, and also the stroke protocol that we'll discuss right after these ones. So the first change that comes up is from the dysrhythmia, the main protocol. It is the changing of the order of the obtaining intravascular access. This will now be able to correct like a loophole that was in our sub-protocols beforehand, where we do have like some sub-protocols referencing a, administering a medication through an IV, but then that would have been, after the step of assessing and treating for the sub-protocol. So we're now moving this step above that. There is the addition along with this in the key points and consideration sections that the intravascular access may be delayed if necessary to allow for emergent synchronized cardioversion of an unstable dysrhythmia.
Thank you. Any discussion on the changes? Okay, seeing none, we'll take a vote.
No, this has to be roll call.
This is a
So
roll
it's
call.
protocol.
Yeah. So we're voting on the dysrhythmia protocol, moving, obtaining intravenous access from number 7 to number 6.
As well as the
As well as,
the changes in the bottom,
oh, okay,
which is similar.
and key points, okay. Please state in favor, oppose, or abstain. Glennis Seda.
In favor.
Dario Gonzalez. Nathan Reisman.
In favor.
Pam Lai.
In favor.
Nick Alexander.
In favor.
Doug Isaac.
In favor?
Louis Marshall.
In favor?
Arthur Cooper.
In favor?
Mark Cantor.
In favor.
Robert Krupe.
In favor.
Laura Ivacoli. In favor. Cindy Vasilios. In favor. Matthew Harris.
In favor.
Jessica Van Voorhees.
In favor.
Ben Zabar.
In favor.
Paul Barbara.
In favor.
David Benelli. Peter Wire.
Yes.
And I didn't call the chair's name. Unless you want to vote. It carries.
Okay, the motion carries. Dr. Lai.
Okay, so the next one is just going to be in addition to the atrial fibrillation and atrial flutter protocol. Just the addition for the key points on here is that paramedics should be treating the underlying cause of the dysrhythmia if it is due to a non-cardiac etiology. That is, if it's due to infection, fever, asthma, behavioral, and the like.
Okay, any discussion on this?
So any discussion on the motion? Changes? All right, seeing none, we'll take a vote.
This is 8-bit.
Yes.
Yeah.
I know there was discussion on this previously. We've all been.
Okay, so we're voting on approving the revisions to the 8-bit protocol. Glennis Seda.
In favor.
Dario Gonzalez.
In favor.
Nathan Reisman.
In favor.
Pam Lai.
In favor.
Nick Alexander.
Yes.
Doug Isaacs.
In favor?
Louis Marshall.
In favor.
Arthur Cooper.
In favor.
Mark Cantor.
In favor.
Robert Krupe.
In favor.
Laura Ivacoli. In favor. Cindy Vasilios. In favor. Matt Harris.
In favor.
Jessica Van Voorhees.
In favor.
Ben Zabar.
In favor.
Paul Barbara.
In favor.
David Benelli.
Yes.
Peter Ward.
Yeah, in favor.
This carries.
Okay, the motion carries. Any additional, Dr. Lai?
Yes, there's more.
More.
Oh,
There's always more.
All right, so the next one is a change to the SVT, supraventricular tachycardia protocol. We're now under the stable SVT, that we have the addition that paramedics should attempt to perform vagal maneuvers. This is going to be consistent with current AHA guidelines. Under the key points and the considerations, it does specify that the modified Valsalva is the preferred adult vagal maneuver.
Okay, any discussion on the motion? Seeing none, we'll take a vote.
Glenn Stada,
In favor.
Dario Gonzalez. Nathan Reitzman,
In favor.
Ann Lai,
Yes.
Nicholas Alexandria,
In favor.
Doug Isaacs,
In favor.
Louis Marshall,
In favor?
Art Cooper,
In favor.
Mark Cantor,
In favor.
Robert Crupi,
In favor.
Laura Iacoli, in favor. Cindy Basilios. In favor. Matthew Harris. Jessica Van
In favor.
Benjamin Zabar,
Favor.
Paul Barber,
In favor.
David Benelli, Peter Wire.
Yes.
Carries.
Motion carries. Dr. Lyon.
All right. So the last one for the set for the dysrhythmia protocols is in the VTAC with the pulse or wide complex tachycardia of uncertain type, where now that we have added to become more consistent with our non-traumatic cardiac arrest protocols, where lidocaine is seen to be an option in that protocol, is that the addition of using as an option for persistent unstable ventricular tachycardia with the pulse to administer one of the following antiarrhythmics, where we have amiodarone, and then the addition of lidocaine now in this protocol. Should I go through the rest of the changes in this protocol?
Yes, please.
Okay. So we've also just for clarity and clarity and for some of the confusion that had come out with the original protocol rollout, is to now to remove that section in the stable ventricular tachycardia with the pulse section, so that now that if there is a need to administer an additional antiarrhythmic, that is going to be a medical control option. So that you can see for number 6, that for persistent or recurring ventricular tachycardia with the pulse, they can redose one of the following antiarrhythmics that we're seeing above. We also have the addition of just some clarification for the language for concerning the VTACs with the pulse concerning tricyclic antidepressants, as well as an addition of a key point that came up in medical standards for those patients who have persistent or recurring VTAC with a pulse despite antiarrhythmic medication administration. It is preferential to continue additional dosing of the same antiarrhythmic medication rather than switch to a different medication.
Any discussion on this protocol? We're gonna vote on the whole.
Any discussion? Seeing none, we'll take a vote.
No voting on this change.
Voting on revision of the TAC with the pulse,
So all the changes in
all the changes.
ventricular tachycardia pulse.
Glenn Stada,
In favor.
Dario Gonzalez, Nathan Reitzman,
In favor.
Pam Lai,
In favor?
Nicholas Alexandria,
In favor.
Doug Isaacs,
In favor.
Louis Marshall,
In favor.
Arthur Cooper,
In favor.
Mark Cantor,
In favor.
Robert Crupi,
In favor.
Laura Iacoli, in favor. Cindy Basilios. In favor. Matthew Harris.
In favor.
Jessica Van
In favor.
Benjamin Zabar,
In favor.
Paul Barber,
In favor.
Yes.
yes, Glenn Stada, Peter Wire.
In favor.
Carries.
Motion carries.
Okay, there are a couple more.
Dr. Lai, anything further?
Yes, just one more protocol that was discussed in the medical standards is changes to our current stroke protocol. There is no substantial changes to the main body of the protocol. However, just in the key points, we essentially want to redefine how and when providers will be contacting online medical control. The change will now be such that for any NYC SLAM score greater than or equal to 4, that regardless of whether or not the patient has any exclusion criteria, they are to contact online medical control for that transport destination decision. That is the substantial change. There is also the addition for the key points and some considerations that for patients who have a complaint of stroke-like symptoms with the last known well of less than 24 hours that have resolved, they should be evaluated for a stroke. These patients may have a transient TIA and may present with an NYC SLAM score of 0. These patients should be transported to a primary stroke center.
Thank you. Any discussion on the proposed changes? Seeing none? We'll do a roll call.
Glenn Slater. Dario Gonzalez. Nathan Reisman.
In favor?
Pam White.
In favor?
Nick Alexander.
In favor.
Doug Isaac.
In favor.
Bruce Martin.
In favor.
Arthur Cooper.
In favor.
Mark Hanford.
In favor.
Robert Cooper.
In favor.
Laura Iacopoulos. Cindy Basilios. In favor. Matthew Harris. Jessica Van Ruiz. In favor. Benjamin